Hello everybody and welcome to today's Community Pharmacy Greater Manchester Care Record training. My name's Leanne Liptrot and I'm Clinical Change Lead and support with the implementation of the Greater Manchester Care Record in Bolton. What we're going to cover today is an overview of the Care Record, how the Care Record can support you as pharmacists in the community, how to access the system, and we'll do a full demonstration, what information you can see, and then further training and support that's available to you. So firstly, we would just like to air out some different terminology that's being used. So what is BCR, GMCR? So originally, we were sharing information within the organisations in Bolton, and the name Bolton Care Record was coined. Following that, we have now started to share information across Greater Manchester, and so we have rebranded to the Greater Manchester Care Record. GraphNet's the supplier of the system and CareCentric is the product. So sometimes you might hear the system being referred to as GraphNet or CareCentric. But the important thing to remember, no matter which term that you hear, we are all talking about the same shared care record. And in response to the Control of Patient Information Regulations, the copy notice, we are now sharing information across Greater Manchester, as I've mentioned, and we are now called the GMCR. So what is the GM Care Record? So we wanted as a locality and as a region to make sure that no matter where the person lives, that all professionals can have information relevant for them in order to make appropriate clinical decisions. So the Care Record actually brings together information from all the different organisations, including the Foundation Trusts, Children's and Adult Social Care, GP surgeries, Greater Manchester Mental Health, acute and specialist trusts across Greater Manchester. And we're supporting care for all of GM using this system. So how does it work? So if we imagine the care record is here at the right hand side, and we've got all the individual systems here on the left. So we've got GP practices, acute, specialist trust, social care and mental health. What happens is throughout the day and overnight, information feeds from these systems into the care record. As well as being able to view that information, the organisations themselves can actually view everything together. So everybody that's feeding information in can also view the information. And we have got additional users that can view, including Bardoc and NWAS and the hospice. So what will you see on the Greater Manchester Care Record? So as a pharmacist, you have a specific view, and that includes all the information that is here and available on this slide. And we will go through this in more detail with you through the demonstration. But you have got a very good view of all the information, and there aren't any exclusions of what you can see on the care record. So what's new? We are constantly evolving the system. So we are always looking for improvements, information that people require access to, and looking at increasing the information that's available. So at the moment, we're looking at a social care feed, an enhanced feed for children's and adult services. Mental health feed is new. And also we have a cancer care summary tile as well, which again, I'll show you through the demonstration. And now that we're sharing information across Greater Manchester, importantly for us in Bolton, this includes Wigan and Salford Hospitals information as their neighbouring localities to us in Bolton. We also have the acute radiology results, and these are what we call real time. So as the results are uploaded, you can see them straight away on the system. So if somebody did have a result this morning, you would be able to see it this morning. What's coming soon? So we're looking at further enhancements to social care data, real-time information from A&E and pathology, and we're also working on community services feeds as we start the transition to electronic patient records. We'll be able to surface the information from our community partners, for example, district nursing. Okay, So I'm going to complete a demonstration with you. We're going to look at the reason to view screen, medical history, medications, and allergy information, which is the feedback we've had, which would be really important for yourselves as pharmacists. So I'm just going to click onto the care record. So the care record works off a URL. So this is a web-based platform that you can access using a Microsoft Edge or Google Chrome. We've been working hard in the background with your IT suppliers to make sure that everything is whitelisted so that you are able to access this web page and it's not blocked by your browser. We have a SOP in place, which includes how to request an account, and we will share that with you following the training. For now, if you imagine I've popped this URL into Google Chrome, and I'm now just going to add my username and password. And please know, if you do ever forget your password, there is the forgotten password button here that you can utilise. And one important point about this first page is please make a note of the data confidentiality and system security information, as we are all obliged to adhere to that as part of our professional registration. Once you're happy, please log in. And it does save your previous searches. It will save the last 5 searches that you've made. So I've just quickly cleared those. But what I'm going to do today is actually show you one of our test patients. So simply search for your patient using first name, surname, date of birth. If you have the NHS number, that's perfect. You can use that. Patient number is usually the RMC number. So again, if you have that, we can utilise that. Oops. Okay. Apologies. Searching the surname, not the forename. And now once I've found the patient that I am looking for, I can double check their date of birth. I can also double check what the GP, what their address is and who the GP practice is that they are linked to, just to make sure that it is the right patient record that I'm accessing. Once you're happy with that, if you click on the patient's name, you will then be presented this reason to view the record screen. Now, please be aware this is not a permission to access the record. Everybody who has a legitimate reason to access that patient's record, for example, you are working with that patient, they've presented at your pharmacy, you are able to access the record without asking the person's consent. We do understand that this is slightly different from the summary care record. So it should make things slightly easier. But once you are presented with this, if you click the select button, and here it is explaining that the reason, you just need to log the reason that you're viewing the record, and this supports with the audit log in the background, just making sure that we are safely using the system and that there aren't any misuses. So there's a couple of reasons for COVID-19, for health and care conditions, or both of the above. I always use for system admin just because of my role, but I'm going to imagine I'm a pharmacist today, so I'm going to click on both of the above. Once you're happy with that, hit the proceed button, and then the care record will load up. If there are any patient alerts, this will be the first box that pops up for you. So you can see that here. Once you've read those, please click the continue button to clear them. But these are usually pulled from Foundation Trust and GP practice systems. Okay, so this is how the care record looks, and this is what we call the landing page. So you can see there's a number of tiles across the top, but you can also scroll down as well to see some data. Now, it's complete personal preference which way you would like to use the system. You can either look at the information directly in the tiles, and they're quite self-explanatory, as you can see, or you can look at a summary of the information that's held in those tiles as you scroll down on the landing page. And if you do want to view more information, so for example, we can see here NDT meetings. The most recent one was in February this year. You want to have a look at more information, simply click on the arrow there on the right hand side, and it will load up the information within the tile. Or alternatively, you can just click straight into the MDT tile and view the information in there. So everybody will work on it slightly differently. It's just about what works best for you. Also be aware, any issues with data feeds, there will be a banner and a warning sign that will appear at the top. So it's always important to just make a note of that in case we are experiencing any technical issues with the multiple data feeds that we pull into the system. Okay, so some of the things that we have been informed would be very useful for community pharmacy is in particular the GP information. So here we can see a list of all the medications, current ones that are being issued and also repeat medications. And please note it says here it's showing 1 of 3 of 460 items. This patient's got quite a lot of medication. So to view all of them, we click on the arrow here on the right hand side and it will bring all the medications up for you. Again, I'm not a pharmacist by background, so I'm not going to go through